The Board of Commissioners recently received an update from Wake County Human Services on the implementation of Ncfast. Ncfast is a program designed to improve the way the state's Department of Health and Human Services and county departments do business. With us to talk about Ncfast is Liz Scott, Assistant Social Services Division Director for Wake County Human Services. Thank you so much for being here. First, Ncfast is a software program issued by the state. What were the goals for the software and its intended purpose?
Well, it is an electronic case management system that is statewide, and the goal of this program really is to improve and streamline access for people who are seeking out economic benefits such as food and nutrition services, Medicaid, and the Work First program. The idea behind the program is that people will be able to apply from anywhere, and they'll be able to receive the benefits that they need without having to file multiple applications and see multiple caseworkers.
And what did the county do in preparation for the implementation of this program?
Well, the first program to roll out in Ncfast was the Food and Nutrition Services program, and we began taking applications for that about a year ago. And all of our cases were converted in February of this year. So we had a lot of staff training that happened before the program was implemented. We hired some temporary staff to do some data entry into the system of data that needed to be converted into the new system. Our staff have worked overtime trying to catch up, and we have tried to have a good communication plan with our community partners, such as the food pantries where we refer clients who are in need of food.
What were some of the challenges as you tried to implement this first phase of the program?
Well, with any new computer system, we know that we're going to have a learning curve. So as people learned how to use the system, they were slower than they had been in a system that they had been using for many years. So we knew that our productivity would slow down at the front end. We also knew that because there was so much more data being entered into the system on the front end than in our old paper system, that we would be able to see less people every day than what we were used to seeing. In addition to that, there have been some system glitches where things aren't working exactly the way they should be working in the system. And as a result of that, we have also seen some slowdown in our productivity.
What has the county done to respond to these challenges?
Well, we have gotten quite a lot of new resources. We have hired quite a few temporary staff. Our permanent staff continue to work overtime to try to catch up. And we have, made a real concerted effort to work down the backlog so that clients can receive their benefits.
You mentioned that this software is used for Medicaid and the Affordable Care Act. How has the county prepared for this transition?
Well, we've tried to learn from what we have experienced in the food and nutrition program. So we have an effort right now where we are trying to get caught up on all of our Medicaid cases so that when that program rolls out, we'll be a little bit better prepared. We are participating with our community partners as far as how Wake County will respond to the increased volume with the Affordable Care Act, because we know we will see additional Medicaid applications as a result of that. Part of this system is to have an integrated process where clients can apply and receive multiple programs. And what that's meant is our staff have needed a lot of cross-training so they can become proficient in those other programs. And we've been engaged in that for several months.
Before we close this segment, how can residents that may have found some difficulty in getting their food and nutrition assistance or other benefits, or those new to the system, where can they go for help?
Well, they can go to our website, which is wakegov.com. We have a call center, and we have staffed up some people to help with resolution of problem situations. One thing we do want the public to know is that if they've experienced a delay with their benefits, when their case is processed, they will receive benefits back to the original date that they were eligible, and they will not miss out on any benefits.
Liz Scott with Wake County Human Services, thank you so much for being here.
You're welcome.